Mental health was identified as the #1 health issue in Milwaukee County last year.
And according to the city's health department, people of color in the county are the most impacted, with 45% of Hispanics or Latinos diagnosed and 33% of African Americans.
And tonight, CBS 58's Ellie Nakamoto-White introduces us to some members of Milwaukee's crisis assessment response teams who work every day to help those in need while breaking down the stigma.
With 1 in 4 adults in Milwaukee City or County having a mental health condition, trained professionals like April Mbita and Jay Ehlers are here to help.
We respond to mental health crisis calls in the community.
For the last 3 years, Mbita has worked as a behavioral health services emergency clinician.
I just have a passion to want to help people that have mental health and substance abuse concerns.
Each day, she and Officer Ehlers respond to calls from people in crisis.
They may not feel off, or they not feel themselves, or they're worried, or they're literally just having, or truly having a bad day.
The two are members of Milwaukee's Crisis Assessment Response Team, or CART.
Everybody has their own approach. I know a lot of us, when we go in, the first thing that we want to do is establish rapport.
And then they'll assess.
When I say assessment, I mean, we'll ask them about their mental health, what they're experiencing, any providers they have, caseworkers, if they're in contact with a therapist, psychologist, what kind of medications they take.
The goal, to de-escalate.
I can take an hour at a call, and sometimes not even scratch the surface.
And then get the person to voluntarily seek treatment.
Hopefully we're able to connect with someone that can see that we care about them, and maybe we can help them feel hope again for feeling better.
Especially when they could be responding to the same person multiple times.
He was younger than me, and it was a deployed setting, and he saw some things he didn't want to see.
Like this veteran who suffered from alcoholism.
And then he kept trying to kill himself. He had so many failed attempts. And I was always called too late after the fact. But repeated interactions with him, he started to call before.
Now it's been nearly half a year since his last.
From what I know, that he is still alive and well.
It's a tough yet rewarding job for those like Officer Lowell Shawfield.
Almost a year on CART.
Who says his best piece of advice is simple.
Probably one of the best tools you can have on you is like listening, acknowledging. You don't have to go down a trail with them on what they're saying, but acknowledge what they're feeling, because their feelings are real to them.
CART launched in 2013.
I can't really quantify how important it is. It's just that important.
Now, more than a decade later, the program is still expanding.
Over the years, we've also worked to increase our collaborations. We've expanded to partnerships with the Sheriff's Office to be able to respond across Milwaukee County for those areas that don't have dedicated teams.
And officials are hoping that with a multidisciplinary approach,
there are opportunities for all of us where we may not be at our best, and that isn't something to be shy or ashamed of.
They'll be able to highlight that mental health is a spectrum.
The hardest and easiest thing to do is to reach out. Don't be afraid to call if you need help. We'll be there.
In Milwaukee, Ellie Nakamoto-White, CBS 58 News.